Okay, are you feeling like somebody's out to hurt you?
A woman, very suicidal.
And were you detoxing from a substance?
I'm going to bring you in to come see one of our emergency prescribers.
It is a typical day at the Central Intake Center at Jefferson Center for Mental Health.
Have you ever actually come up with a plan to harm yourself?
Here at Jefferson Center for Mental Health, we try to provide mental health services to anyone in our community who's in need.
One of these people was Amanda when she came in just in time 3 years ago.
At 16, they diagnosed me with bipolar. I was really suicidal. I was involved in a lot of self-destructive behavior, including cutting on the skin. I would starve myself. I took a lot of pills just to make myself sick.
Symptoms can range from imaginary voices to runaway anxiety to overpowering depression.
My thoughts raced all the time. I could see and hear things and feel things that weren't there. It was really awful because I never knew if something was really there or not.
After beginning treatment, Amanda transferred into the Jefferson Center's wellness program.
The first day that I came, I was a huge relief because I called intake twice a day crying. And then I got a therapist. Started off with one wellness class. Also, I got assigned a peer specialist. It's really great having somebody who had a mental illness that was helping me.
For Amanda, it's been a night and day reversal.
It was life-changing. As I became involved in the center, I stopped hurting myself, and it's been over 3 years now. With the support system, I know that I have people I can call and they won't freak out because they've probably been through it themselves.
Now, what she's been given, she's giving back.
I help out with the mentally ill people that are going into social services, and I'm also trying to get on the State Advisory Council. Just thank you, JCMH, for everything that you've done for me. Definitely, it's a lifeline.
One of the many ways Jefferson Center reaches out to our community is through the Senior Reach program.
Before I was involved with Senior Reach, I was depressed and had totally lost all confidence. My son died recently enough that all that came back, and certainly I was grieving. The therapist from Senior Reach, she gave me the confidence to go ahead and techniques to concentrate on positive things. And someone who encouraged me, I think. It was like a barrier had been lifted. And I'm much happier now, much more contented. This is what made the great change, really.
It's people like Amanda and Ruth who inspire the staff, along with the feedback from the client surveys.
I have one here that we got earlier this week, and she wrote, "I came here today feeling scared and unsure, and I left feeling hopeful and informed." It's really very gratifying to know that we've been part of that.
Last year, more than 18,000 people got help at Jefferson Center for Mental Health. Unfortunately, there are many who do not. Mental illness touches 1 in 4 lives. But for those who do get help, it means recovery. It means hope. It means everything.
If I didn't have Jefferson Center for Mental Health, I'm not even sure if I'd still be here. People didn't think I'd make it to my 30th birthday, and that's next year, so I'm really excited about that.